Hi everyone, it's Amrita Tripathi for and from the Health Collective today. This year's theme of World Mental Health Day is it's time to prioritize mental health in the workplace. And on the Health Collective over the last 8 years, we've done several talks, several stories, shared many panels and discussions, but I'm extremely excited to have on today Arpita Anand, who's joining us actually from Dubai. Arpita is a counselling psychologist with more than 2 decades of international experience, very well known and beloved, certainly here in India, and I'm sure in Dubai as much as other corners of the world. Arpita, thanks for making the time today.
Hi, Amrita. Thank you for having me. It's a pleasure.
I think for our eagle-eyed listeners and followers, you've been, from when the Health Collective was set up, we featured quotes and articles by you. And of course, we co-authored that book on depression back in the day, a few years ago, as well as having you on so many interviews, I think almost 20 years ago now, back when TV news was still a fun place to be. So I'm really glad that we can, come full circle here and talk about some of the things you've been really beating the drum on before it became a trend or a theme. But let me take a minute to ask you, when you see a theme like this about prioritizing mental health in the workplace, what are your initial thoughts? And is it finally, we've been waiting a while for these kind of conversations to get mainstreamed?
Yes, and I'm so glad that you've brought this up because I think it's been a long-standing issue that has unfortunately been normalized in terms of the stress, the demands at work. It's been normalized to say that, that's what you need to do, get on with it. And I think the messages that it sends out to people are just really unhelpful and actually can be quite toxic. What we need to respect is the fact that, most people will spend long hours at work on a regular basis, and it significantly affects their mental health. So often there's been focus on how other aspects of an individual's life affect mental health, but the workspace has not been talked about enough. And it's high time that we talk about that because it's a significant contributor to mental health or the lack of it for that matter.
And Arpita, when we talk about mental health, there's the fact that we all have mental health. It shows up in different ways in our lives. It's not a silo. There are mental health conditions and mental illnesses as well. So as we structure this conversation a little bit, I want to ask you, what are some of the concerns about mental health and the workplace? The WHO has a few of these fact sheets and guides, which we'll share with people as well. But when you look at some of the top stressors that people come in with, and I'm not even talking about, say, toxic workplaces, which have a different categorization altogether. But what are some of the top stressors that people come in with?
I think one is the simple aspect about the demands and matching of skills that an individual has, the demands of the role, interpersonal relationships at work, the space where people can talk or not talk about their issues. I think it's the whole spectrum, really, and also the competitiveness that exists in the environment. So I think these would be some of the immediate things that come to my mind, people talking about it, that really affects them and their sense of well-being. And then the increase in the stress as a consequence of these factors leads to an impact on their performance.
So if you were a manager of a team, or a team leader or a founder even, and we know that founders and startups have their own entire buckets of stress. That's something that's come up in the past. But if you were leading a team, or you were advising team leads as you do, what are some things you would say people should be on the lookout for that could be a cause for concern?
I think the first thing that always comes to my mind is empathy. We are people first, and then we are at work doing our jobs. So irrespective of what the demands may be, and I understand that there are a lot of professions that are very demanding, high pressure, there's a lot at stake as well, but that doesn't take away from the fact that, when you're a manager and you're dealing with a team, the people on the other side are people, they're humans, and there are things that are going on in people's lives, and all of that needs to be respected. So I would definitely start by saying empathy, and I would start by saying that having the space for open communication, and that's really important as well.
And we're going to share a bit from the WHO fact sheet in a minute, but I do want to ask you, we've heard from people, and I'm going to give you a few questions that have come in from viewers and members of different groups and so on. But we've heard from there was a talk I was doing recently talking exactly about this, about empathy and the importance of human-centric leadership, which is now like basically I think in this age of ascendant AI becoming more critical than ever, to talk about people skills and why you need to be centering on empathy as a leader. And someone said, even when you're trying to be empathetic, and I'm going to paraphrase here, but basically they were saying when you're an empathetic leader, sometimes what happens is that people will also, for lack of a better phrase, weaponize mental health issues. So they'll have like younger colleagues, especially. They said younger. I'm not saying it's Gen Z, but I know Gen Z has a better sense of their rights, certainly than a lot of other generations that came before. But they're saying there's this kind of balancing act you end up doing because you want to be empathetic, you want to be, providing that safe space, but at times it can feel like, maybe regular stress. I don't want to use regular, but you know what I mean? Something that's not as serious as potentially it's being played as. Do you think that there's a flip side to this, or anything else we should be mindful of?
Yeah, I mean, of course, Amrita, I completely agree that there is always that risk because, while we're talking about difficulties in the workspace, on the other side as well, we have to recognize that it's not always that people will be fully committed and fully conscientious. You will get an entire spectrum. So sometimes people may not be able to respect the space that they're being offered, or, an empathetic manager might not be respected in the same way that maybe a more autocratic manager might be respected because, that's the culture that's built up. But that doesn't take away from the fact that those changes are essential. And I think what's important is that maybe, the whole system needs to recalibrate. And when there is a shift that's beginning to happen, the shift will involve some of these issues, which will then need to be tweaked and worked with, hopefully leading to a better balance in the future.
Yeah, and I was also thinking about that, and I thought, it's still better to err on the side of caution, right? You might have a few people who are, as you said, not conscientious, but by and large, I think, especially in cultures like ours, people would rather not say anything, actually, even at detriment to themselves, because there is so much still stigma and shame and embarrassment around these things.
Yes, absolutely. And as I said that, it might require a period of time before which we can reach a healthier balance. And there is no perfect balance, really. So, it's about navigating through different experiences. And I suppose that another sign for, another sign for a good manager would be something that is performance related, but it doesn't mean that these are exclusive concepts. I think it can be built in. And I think that's the sign of a good leader in any case.
No, 100%. And I think, I do want to ask you a little bit about what we were talking about earlier, but the importance of not normalizing stress in the workplace. We've come to this stage where, the hustle culture was very big, I think, the last year, couple of years, but people are starting to realize that, there's such an uptick in burnout. So many terrible things can happen. They've been in the headlines recently, especially, due to overwork. People, to the extent of losing their lives, but certainly losing their mental health and balance. So when you talk about not, trying not to normalize the idea of stress in the workplace, can you share a little bit more insight?
Yes, absolutely. I think one of the things is that because, often workspaces can be very demanding, and then there is not enough opportunity and space for people to talk about the way stress may be impacting them, because it's seen as a reflection of an individual's capacity, to perform. And then if people are talking about the impact that stress is having on them, it's probably viewed in a negative light. As a result, what happens is that people end up normalizing it and say, that's the demand, that's the way it works. If you have a difficult manager, normalizing by saying, oh, that's what managers are like. And that kind of normalizing basically leads to the individual absorbing a lot of that stress and making it about themselves. So if they think that this is the normal culture and I'm not able to cope with it, then there's something wrong with me. And the impact that that has on the well-being of that individual is obviously going to then be negative.
That makes a lot of sense. I also do see joining us, and fingers crossed that Shubhrata can hear us, Shubhrata Prakash joining us. Shubhrata is a government servant and author of the D Word, and certainly a friend of the Health Collective. Shubhrata, thumbs up. Can you hear us?
I hope you can hear me, you can see me, because I was having some technical difficulties getting in. I'm traveling, and I wish I could have shown you the beautiful place I'm in, but in any case, yeah.
Well, we'll just get FOMO if that's what you were hoping to do. That's well achieved. Shubhrata, let me ask you. The first question I asked Arpita was, the theme this year for World Mental Health Day, it's time to prioritize mental health in the workplace. What are your thoughts when you hear that theme?
I cannot stress this enough that this is a really, really important issue, and I'm so happy it has been taken up. And I just hope that people start, take their cue from this theme for this year, and instead of just the performative soft skills, wellness programs, etc., people actually start paying attention, especially in the workplace, to mental health. And I would, just like to emphasize again that when I say workplace at the mental health, it is not just the responsibility of the individual people, the employees who are working at at any workplace. It is mostly the responsibility of the employers to provide enough support to the employees, and just doing a little bit of this little bit of meditation, yoga, exercise, having these talks, that's not enough. In fact, I just was telling someone the other day that I am often asked by a lot of corporate entities to come and deliver a talk for their employees. Now, the thing is that how many people are really interested? It's seen as an additional task, rather it puts stress on the employees who already overworked. This is not taken out of their regular work hours, right? This is put on a day or at a time when they just want to keep everyone busy. So that's just not the way to go about taking mental health seriously in the workplace. There's a lot more has to be done.
And Arpita, to ask you that, actually, I've also seen this, and I've seen a little bit of grumbling about this idea that you can provide a yoga day or a mental health wellness day, and forget about the fact that your employees are perhaps overworked, underpaid, and stressed out constantly as a result. Is that something you'd also agree with across sectors?
Yes, I would definitely agree. Although there's a slightly different perspective in that I think sometimes these kind of conversations just allow people to be able to tune into other strategies and techniques that they can pick up on. So it's not about just having like an isolated talk and saying today's the yoga day, but how maybe things like breath work, yoga, meditation, any kind of an exercise routine can be integrated into the life of the individual. It can make a very, very big difference to the way they're coping with stress. So I think the purpose that these kind of talks and workshops can fulfill is to create a lot more awareness about what are the changes that the individuals can bring about and incorporate these skills into their day-to-day functioning as a way of coping with their stress.
And I'm just going to quote. I wasn't able to really share this screen, but I'm going to add it in post production, hopefully. But this WHO fact guide, and there's a resource talking about how important it is to promote and protect mental health at work. They talk about manager training for mental health, so you can help managers recognize and respond to when your supervisees are experiencing emotional distress. They talk about training for workers in mental health literacy and awareness. They talk about interventions for individuals to build skills, as Arpita was saying, to manage stress and reduce some of those symptoms. And there's a separate section entirely, and I'll bring you both in on this, which is, one is preventing and protecting and promoting mental health in the workplace, and tips that we might all benefit from using. And then the other is to support people who have pre-existing mental health conditions, to help them participate in and thrive at work. And that's something I think we hear less of, and might be helpful to think through also what is an approach there. Shubhrata, you have lived experience. You've been a mental health advocate. You've talked about dealing with depression, and you're also someone that a lot of people, as a result, come to at the workplace and outside.
Yeah.
Can you tell us through a few of your suggestions here?
I'd like to add something here to what Arpita was saying. And yes, of course, this is very important. But as you pointed out, wellness is one thing, and people keep talking about doing something which is preventative or preventive as far as mental health is concerned. Now, it's very important to understand here that mental health itself has three determinants, the bio factors, the social factors, and the psycho factors, which are the individual's own thinking. So therefore, mental illnesses also are of biopsychosocial origin. Now, it's not possible to prevent. Suppose somebody loses a loved one. How can they prevent grief? How can they prevent that grief from morphing into maybe depression? So it's okay to talk about the soft things, but it's really, really important to focus where it really matters, because people with mental health conditions don't speak up. They don't speak up at all in the workplace because they really have there's a fear of losing their livelihood is really, really big, because there's so much of stigma. In fact, in the last week itself, I've had two colleagues approach me, asking me what to do, because they have been asked, they have mentioned their mental illness at work, and they've been asked that if you are not well, if you have mental illness, how can we expect you to work at all? And somebody was asked that, why did you not mention this upfront when you were applying for the job? So, do you think this kind of attitude is ever going to clear the way for people to come up and speak about their mental health and seek help for it? No, this stigma is exactly the reason why people hide. Mental illness hides in the darkness. And I'll come to what is the solution there. But this is something that I really wanted to bring out as a phenomenon, because people do, in fact, in my own department, or colleagues across the bureaucracy, and people outside the bureaucracy, people working in private concerns, because I have been advocating for mental health. So a lot of people do reach out, but the biggest fear is this. And the fear that, they question, why didn't you mention it? I mean, what if someone gets this disability or mental illness after entering the service? Are you going to throw them out? And on what grounds? So this is
Yeah.
something, not everyone has the privilege of talking about it, because people need to put food on the table.
Agreed. And I think, when we talk about stigma, there's also discrimination. Arpita, and I feel like not all of our cultures or organizations in all of our markets, let's put it that way, are necessarily helpful when people are, disclose openly. What are your thoughts there? And you also have worked with people, in India, in the Middle East, in the US as well, which I feel will, have a slightly different set of rules and regulations. But what are your thoughts on this?
So I think what is really important to recognize that this is an entire spectrum in terms of dealing with stress at work, or maybe not having the right kind of a work culture, that creates stress and anxiety, or difficulties in terms of when mental well-being, versus certain people down the spectrum who may have certain conditions because of multiple reasons. Work could be a stressor, and it could be other life conditions, or for that matter, other predispositions that lead to mental illness. I really believe that it's all right for people to have their own space, and anonymously deal with whatever it is that they're dealing with, provided they're getting the right kind of help. And I work with obviously a lot of people with mental illness. Very often they'd like to maintain the boundaries of not being very open and transparent about their mental illnesses, but at the same time expecting a healthy work culture and work environment that facilitates their performance and does not interfere with their ability to be able to manage their mental well-being. So in some ways, what I'm saying is that I don't think there needs to be, it's not essential for the work culture to be such that people can necessarily open up, because some people would like to be more open and some people would not. And I think it's individual preferences about how much people wanted to disclose. But I think that's the conversation about people with mental illness. I think one part of the conversation is just about general mental health being respected. So you don't have to have a mental illness to struggle with difficult work environments. You could be without a mental illness, but your mental health could be impacted as a consequence of a stressful environment.
And the same WHO fact guide I'm going to link here. It says work can be a setting which amplifies wider issues that negatively affect mental health, including discrimination and inequality based on different factors. And they go on to say, to Shubhrata's point, that people with severe mental health conditions are more likely to be excluded from employment, and when in employment, they're more likely to experience inequality at work. For the scope of a 30-minute discussion, we can't solve all of this, but I do want to ask you both, what do you think would be helpful? And Shubhrata, coming to you, you're in government, you have, of course, friends and people coming in from across private and government sector asking what they can do. Let's say that, let's assume good intentions, and let's say that there are team leaders and organizations that want to go beyond just the symbolic tick mark of World Mental Health Day, and we're going to institute a yoga day. We want to look at creating a more enabling environment. What would your advice be to them? And then I'll come to Arpita for the same.
My advice would be that just look at the policy. We already have a national mental health policy. We have the National Mental Health Care Act. But where does the implementation down to the lowest unit lie? That is a big question for all organizations to answer, because I don't see enough happening. Why do people have the gumption to ask questions like, if you have mental illness, how can you work? How can we keep you employed? Or why did you not disclose it upfront? Now, the Mental Health Care Act says simply that if someone has a history of a particular disorder, that does not mean that they are branded for life. It is very clearly there in the Mental Health Care Act. But the question is, how many people have even opened the Mental Health Care Act, or are they aware that something like this exists and this is discrimination? No, most people, if you ask, they would not have even heard of this, or they would not know that such a clause exists. So it is very, very important that if we are to take mental health and mental illness, because honestly, mental health impacting people's mental health, anyone can have a negative mental health day. Anyone can feel a little low at any point of time. I am basically looking at the real problem, which is where mental illness exists, and that is why we have to talk about mental health, because it is actually the absence of health which is bringing this thing the whole issue of mental health into really big focus right now. So people have to have some kind of, organizations need to build some kind of mechanism to give training. Like there are trainings on POSH Act, there are so many trainings and so many different rules and regulations. The government has made the act, the parliament has approved the act. So we do need to have more organizations having training workshops for everyone, not just the mental health care professionals, but just
Yeah.
individuals, so that individuals know that this is my right. And I was
Yeah.
very happy when a colleague just a couple of days back said, "Ma'am, I think I want to really fight this." I told him, "It's a big battle. You go ahead." But I was so happy to see his spirit, that despite having a mental illness, he said, "Ma'am, I'm going to fight for my rights." And I said, "Please go ahead, please do it." So that is from the individual's point of view, but organizations have
They
responsibilities. They
should
cannot shrug off.
go ahead.
From the larger mental health policy, the national mental health policy, organizations need to have their own policies in place.
Yeah. So, actually, that's a perfect segue. Arpita, someone sent in a question which I want to put to you, which literally asks, how does an organization start forming policies on something that is relatively more intangible and dependent, in brackets, and rightly so, on the individual? Saying, where do you even begin? And going on to, and I'll paraphrase, going on to say that, you could run the risk of also being too generic, because if you can't, be so tailored to one individual. So where would you say is a good starting point for organizations?
I definitely think the starting point for organizations is to basically create more awareness about mental health and to create more awareness about how, some of these, what we were discussing earlier about the kind of stressful work environments that are typically normalized, creating awareness about how that is not normal. So I think a lot of awareness about mental health, definitely creating opportunities for training, for leadership, so that it filters down in the right way. And then I think as far as the individual is concerned, which is like, what responsible organizations tend to do is have some kind of a system, whether it's a system within the organization for some space for employees to talk about it, or even a referral system, because beyond a certain point, if there are people who are struggling with their mental health, they're going to need the right kind of professional help to be able to deal with it. So, mental health professionals liaising with companies and corporates to be able to provide the right kind of services, so that individuals who need it have the right access if it gets to that stage.
And Arpita first, and then Shubhrata, because I know we're against the clock. I cannot let you both go without asking for some tips. So, Arpita, I'm going to ask you, if I work in a workplace, I don't consider it to be a toxic workplace, but hypothetically, I work in a workplace that doesn't really care, which could be a lot of the newsrooms back in the day. I will say it was not in our vocabulary at that point. What are some tips for stress management? When do you want me to be, looking out for help proactively? What's your advice to someone who's looking out for themselves?
I think before I jump to that, just one quick thing. I think it's really important for every individual to make sure that what they're doing is aligned to their needs and their goals. I think it makes it much easier for people to be able to cope with any stress that comes up if you know that what you're doing is very aligned to your goals. If there is a dissonance, it creates a higher degree of stress. So that's the backdrop. But if the stress does come up, I think the warning signs would be, the basic thing: sleep getting affected, appetite getting affected, mood getting affected, irritability, your time for yourself and for your family and loved ones is not the right kind of time, and you feel that there isn't enough space for you to be able to do what you'd really like to do in a more wholesome, holistic way. I think and there are also a lot of signs in terms of physical health difficulties and certain symptoms, because mental health and physical health are not separate at all. So anything that feels different to your norm, to your individual kind of norms, look out for that, and get help right at that stage. I think that's what I would recommend.
Thank you so much. And Shubhrata, to you, when we talk again about that difference between speaking about, preventive mental health versus having a mental health condition, when people come to you and ask your advice, when should they be reaching out for help that might not be provided at the workplace? What are some of your suggestions?
My suggestion, so I mean, it's always the same, that, look out for the signs and symptoms. It does not have to be fitting DSM or ICD or anything. If you are not feeling good, if you're not feeling functional, there's something bothering you and you're not able to get over it. It can be something in your personal life, it can be something in your professional life, it can be a big catastrophe, or it can be just something that's building up day after day. If you are not feeling like yourself, you're having some issues, there's some way in which you're not functioning the way you used to do, it's always a good idea to seek help, professional help. It may be something, it may be nothing. It may be a disorder, or it may be just a low mental health day. But there's just no harm. Do check in with a loved one. But a lot of times, what happens is that loved ones will say, "Arey, kuch nahi hai. It's nothing. It's all in your head. It's okay." Of course, it's in the head. The brain is inside the head, right? So, yeah. So, if there is anything that feels a little off, there's no harm. There's no harm. Please do reach out for help. Don't suffer in silence. And just one last thing I would like to say about stigma, that yes, people do fear losing their jobs. And it's all easy to say that if your work is very stressful, why don't you just check out of there? No, it's not possible. It's a privilege to be able to take a step back, because, as I said, you need to earn your living. Your family depends on you. Not everyone can just walk out. So that is where, again and again, I emphasize that it's not just on the individuals. It is really important for organizations as well to look out for people who have mental health issues.
Yeah, I agree. And we were saying that, at least we have this theme this year. That means that conversations have reached a certain level. I always am reminded that I could talk to you both for hours and hours and hours. And I hope that I can do that going forward as well. Thank you both for taking out the time. Arpita, thanks so much. Shubhrata, as always. And we'll be actually, collecting more questions and sending them your way. That is not a threat, it's a promise. Thank you both for all that you do.
Thank you. Thank you, Amrita.
Thank you. And again, apologies for the tech difficulties.
So if you've been watching or listening, or you catch up on this recording, please know you can reach out for help. As you've heard today, you'll find much more on our website, healthcollective.in.